Dr. Neuhaus. I wanted to talk to you today about a condition which doesn't really have a name. It's more a informative video to help you understand blackened or bruised toenails and what that really means. So people will come in and they'll have some irregularity in the toenail. Maybe they'll have some discoloration. The nails will look black or like they're bruised. Frequently this is associated with trauma. This is a condition that occurs in people who are athletic. Runners will frequently develop toenail discoloration, and oftentimes the nail will even fall off. What this is caused from is bleeding underneath the toenail. When we drop something on the toe, stub our toe, are runners and constantly bruise our toes on the ends of the shoes, we will cause bleeding underneath the toenail. When that occurs, you get the discoloration. A new nail then starts to grow, and it will push this old discolored nail out. So the nail over time will become loosened and will be replaced with a new nail, meaning the blackened nail will fall off. However, there are some cases where it's not from bleeding in the nail, it's actually caused from a nail fungus. The only way to identify the difference, if there is a history of trauma, it's pretty easy to assume that it's from bleeding underneath the nail. If there's no history of trauma, you've noticed it to be a gradual problem, it may indeed be toenail fungus. In those instances, it's helpful to do a nail biopsy, where we actually cut the nail back or remove the nail and scrape the tissue at the nail bed and send that to the lab, and they can look at it under a microscope and do some different testing on it. And that will determine if there's fungus in the nail, which can be treated with medication or lasers or a variety of other things. In those cases, the results are going to take time to see, because nail fungus can be a little bit difficult to treat. In the case of blood being under the nail, you really just have to grow a new nail, and that will take anywhere from 6 to 12 months as toenails grow very slowly. One thing that you have to be careful of is if you do have blood underneath the toenail, that can act as a food source for fungus, and that bleeding can attract the fungus and end up changing from a blackened toenail or a bruised nail, we call that a subungual hematoma, to an actual fungus infection. So in some cases, when there's an acute injury, I will actually remove the toenail and clean out all that dried blood to help try to prevent a fungus from infecting the area. So those are some things to think about when you have discoloration of the toenails. Those are probably the two most common reasons to have blackened or bruised nails, and that would be, again, trauma and bleeding. We call that a subungual hematoma, or a fungal infection. So if you have any questions about that, don't hesitate to give us a call or see your doctor if you're outside the area. But I hope that helps explain a little bit more about toenails. Again, it's Dr. Neuhaus. Thank you.